Hello and welcome to Health and Wellbeing Live in Nottingham City. This is a place that we have informed conversations about all the activity that's happening to support people with their health and wellbeing within the city. This normally goes out as part of the updates from the place-based partnership, but you might have come across this from elsewhere, and everybody is welcome to watch. So today we're talking about the work being done in Nottingham City to support people struggling with financial wellbeing. We'll be talking about what financial wellbeing is and all the steps that are being taken in Nottingham City to support people, and how professionals can get involved, healthcare professionals and social care professionals, and really anybody, and also how members of the public can find support and help. So today I'm joined by Emma Bates. Hello, Emma. Do you want to introduce yourself? Tell us your role.
Hi, yes, I'm Emma Bates. I lead the Multi-Sector Financial Resilience Partnership. Hi.
Hi, Emma. And we've got Helen Johnston. Hello, Helen.
Hi there, I'm Helen Johnston. I'm a public health consultant for Nottingham City.
That's great. And I'm Andy Foster, so I'm a GP and I work within Nottingham City. I also work at the place-based partnership as well. So let's dive straight in and ask the question, what is financial wellbeing? What do we mean when we talk about financial wellbeing?
Thanks, Andy. We've set financial wellbeing as one of our priorities in the Joint Health and Wellbeing Strategy for Nottingham, because we recognise that actually financial wellbeing is really important for our health and for our wellbeing. And as part of that, we have set an ambition that as a city, over the long term, we want to be a city where people are able to meet their current needs comfortably and to have the financial resilience to maintain this in the future. So there's lots of different elements of financial resilience and financial wellbeing. Emma, do you want to come in on those?
And so in terms of putting a bit of flesh onto the bones, there's kind of core topic areas that fall within this field are work around income, credit, debt, banking, supporting saving, money, skills and confidence and knowledge, whether for children or adults, affordable warmth and food poverty.
Okay, so quite a wide-ranging definition there. As a GP, beginning to do a bit of work around sort of population health management, I'm aware that that touches on lots of those areas that relate to the wider determinants of health. So I can see how this is like a really big and important issue. But I was wondering if you can explain in more detail what are the links between people's financial well-being and people's health and physical well-being.
Yeah, so it has a lack of financial well-being actually is really bad news for health. It has a really negative impact on health. So if we think about physical health and disabilities, if you're living, for example, in a cold home, so Emma mentioned affordable warmth as one of our things that we think about. You're living in a cold home, actually it is associated with particular respiratory conditions, particularly for children, but also for adults, higher risk of falls, so we get more hip fractures for people who are living in a cold home. So that's one example of the physical health impacts. But there's increasing recognition in and around the mental health impacts of financial vulnerability. So if you're experiencing financial hardship, that can cause incredible levels of stress and anxiety that make managing that mental health condition so much more difficult. And actually there's a really well described relationship where we know that people who are experiencing debt and problem debt, so kind of really significant levels of indebtedness, 1 in 2 of those people will have a mental health problem, and that's something the Royal College of Psychiatrists have recognised. But also, actually, if we look at all the people who experience mental health problems, we think about 1 in 4 of them are in some form of debt. So it affects people who have these long-standing physical and health conditions, and it kind of compounds those needs. Particular impacts around children and children who are living in poverty. And we also know that it is one of those elements that is part of those health inequalities that we have in our population.
Yeah, absolutely. I'm just thinking of some examples from my own practice as well. You've just made me think about, those patients, often patients actually with say diabetes, they're often of working age and they need to attend a lot of appointments to attend their health condition. And I'm often having conversations about where their priorities are, and they find it difficult to prioritise appointments over going to work, for example, because they don't often work in the sorts of employment where it's easy to get time off, and those sorts of conversations are easy. So I can see how that's, very real for physical health problems. Emma, I think you wanted to come in with a point as well.
Thanks, Andy. I just wanted to add to what Helen was saying as well, that there are a lot of further ripple effects. So having debt problems, for example, impacts the wider family, impacts on child mental health, family conflict, also links to risks around housing and homelessness, and to ability to get and sustain a job. So there are lots of wider factors. And then on those other topic areas that are listed as well, there have been reports around how lots of those other areas of work have links to people's health and well-being. For example, even getting a bank account. There's been research before around prisoners getting a bank account and the impact that's had on people's health, saving, financial capability, etc.
Yeah, so yeah, really wide-ranging effects.
Yeah.
I also think, so I'm sort of sat here as a GP, having spent the morning, doing a GP surgery this morning, and actually, and probably increasingly so, given the financial crisis, which I'm sure will come up a few times this morning, really see the impacts both on people's health, definitely, but actually also on the amount of time we're spending as a service supporting people with the effects of their poor financial well-being. So I think these things having an effect and stretching our services in a way as people's financial well-being has deteriorated, it would seem, over the past few years. So I think listening as a GP and having this conversation, I'm really interested to know what I can do to help people more effectively, and also so that we can reduce some of those demands on the service, by connecting people with the right sources of help. So really relevant, I think, for people listening in my position as well. A question that I kind of have, having sort of seen people, is sometimes you see people who are struggling with their sort of physical and mental health and their financial well-being, and you sometimes wonder what came first, or what's the main driver here, and maybe they drive each other, but what's behind that relationship, and what tends to come first, Helen or Emma?
I'm sure it'd be interesting to hear Emma's reflections. My reflection, and certainly my understanding from the evidence, is exactly as you said, Andy. It is so interconnected that health influences how somebody's financial circumstance, and financial circumstance then influence health. I think what's really important is actually where you've got that interplay in a quite a negative way. You talked about your scenario, somebody who is struggling to manage their diabetes and actually has insecure work, and actually how those kind of compound each other, and we see that. And so for people who experience both good financial circumstances and good health, then we that they can carry on. But for so many people, they are so linked, and actually a change in one way has a negative impact the other way, and that runs both ways round.
Yeah. Emma, any other thoughts?
No, I'd agree with that. Both areas of work are so important, and especially in Nottingham City, where we have high levels of financial difficulty and high levels of poor health, because as Helen was saying, there is that two-way relationship. So absolutely.
This just makes me think about people's starting position, as they go through childhood and become adults, and how actually having a good start in terms of your financial well-being can be protective against getting into some of these downward spirals of ill health and poor financial well-being. And I'm sure we'll talk about maybe some things that are being done for children later on, but it just strikes me that would be a really important thing to focus on. So let's move forward. And so we're having this conversation in Nottingham. So what is the situation around financial well-being in Nottingham as a city, and perhaps how it might compare to other areas of the country or other communities?
Yeah, so thanks, Andy. In Nottingham, unfortunately, we've had very poor levels of financial well-being for quite a long time. So it's actually kind of quite entrenched over many years. I say that I've been seeing the statistics in Nottingham for quite a long while before I started working here. And I know that those issues go back a long way. And then with the costs of living crisis, things have escalated. So some examples are, for example, on income, which is a really big issue in Nottingham. We were the worst in the country for gross disposable household income. That has just changed somewhere in the last, I'm not sure exactly, somewhere in the last year. We're now third worst in the country. Leicester's got worse. But for a long time, we had the lowest levels of gross disposable household income. Also, it's not just as simple as getting people into work, unfortunately, because a lot of our residents who are in work are in very low paid jobs that are well below the East Midlands and national average. So that's a massive issue. We have had, although this has been similar in some other cities as well, high rent rises that have happened in the last 2, 3, 4 years. Alongside those issues around income and costs, we have some quite poor skill levels in the country. In general, with skill levels, wanted to pick out one issue in particular, which is around numeracy. We're talking about basic abilities with numbers. We are 4th worst in the country on the National Numeracy Index. So when people can't understand deal with basic numbers, that impacts their abilities to deal with money day to day, just on quite a simple level. We've also, but it's been difficult to say about this because it's been measured differently over time, but generally speaking, we've been somewhere near the top for people being over indebted, where people have been kind of a long way behind with their bills or been finding them to be a heavy burden. So there is really across a range of factors on financial difficulty, where Nottingham, I think, particularly faces some real challenges.
Absolutely. Anything to add to that, Helen? I mean, I often wonder why are we in a different position, Nottingham, compared to other areas? What did our history has put us in this position? There might not be an answer, but people would ask that question.
Yeah, I think there's probably a real legacy of kind of social and political history, and I'm sure some of our political leaders would reflect how and where the East Midlands hasn't always been in the centre of attention, shall we say, in some of our kind of approaches. Interesting that the city is moving forward in terms of our new economic plan, and really keen, and obviously they've worked with myself and Emma in the Financial Resilience Partnership to make sure that financial resilience element is being picked up. So as we're forming new economic plans for the city going forward, that is very much being reflected. But quite the legacy of why we are where we are is complicated, in and alongside actually where we have a real legacy of health inequalities in our city. And I'm sure in your kind of day-to-day GP practice work, you see patients who probably have had, come from families who've had kind of long-standing health issues over many generations.
Yeah, certainly see multi-generational health and financial issues. Yeah, and going forwards into the future as well, sadly. So very interested in what we can do to kind of help the next generation be more numerate and have better financial well-being. So which I suppose leads us nicely into another question, which would be, what is being done locally to try and address some of these issues? I don't know, Helen, if you can give us an overview of the strategy, and then maybe we can have some examples.
Sure. Yes, we've thought about it in terms of 4 areas to particularly focus on. That first, and it speaks to some of the data that Emma was describing, is really focused around increasing incomes, because we recognise that's a particular problem locally. So thinking about how all organisations can be increasing incomes and be good employers, but how we can, as part of that wider work and skills agenda. Then ensuring access to money help, so for the people experiencing difficulty, that they're linked with support, information, advice. Help with daily living costs, and we are still continue to respond to the increased costs of living, and we have people who are very much at that crisis point, as well as some of the work to prevent needs from arising earlier up, and then improving financial capability. And we've got some examples of some of the work around training and awareness in and around those.
Thank you. And Emma, I think, were there a few specific issues around sort of access to food that you wanted to pick up on there?
So one part of the financial resilience partnerships work links into food poverty or food security. People use different terms. So we have a subgroup of all the food banks in the city, which brings different food banks that operate under different models together to try and improve, to share and improve best practice. But within that, because this is happening through the financial resilience work, we're really keen to embed financial resilience practice even within food banks, even though food banks are that very crisis end of things for emergency food. So that has included, among other things, we've brokered getting funding for welfare advice workers in our 4 busiest food banks in the city. And also there's been some financial capability training for some of the food banks. And when I say that, I mean that money, skills, confidence, skills and confidence aspect I was talking about before, and just making sure as well that the food banks are equipped with all the information about where to services to refer people through, because what we want to do is move people away from that crisis end.
Yeah, and that makes a lot of sense to embed that advice right where people are experiencing, food poverty, which I'm sure is so much related to their financial well-being or lack of. And I just wanted to make some of those strategic areas a bit more real. Are there any examples of specific kind of programs that are happening that we could hear about?
I think it'd be good to think about some of the training work that's in place in and across, and actually that's really relevant to some of our health and care professionals. So at the moment we have a pilot thinking about how frontline health workers can support conversations around financial awareness, accessing a national all our health e-learning resource, but being supported in doing that. And we're testing that out with some of our commissioned mental health services and family mentors in the city, just to understand how we can best support those very early conversations around money. And then that sits alongside a kind of wider approach to training. Maybe Emma, you can describe some of the training that you're involved in.
Yeah, so for workers who are working or like to be working with vulnerable people, we offer training that's tailored to the needs of the group, but generally covers across understanding about financial resilience and well-being, but also gives those workers some tools and tips to use in their day-to-day work. So it's a little bit more in depth and is particularly relevant to workers who are more likely to be working with vulnerable people, which is actually in Nottingham City quite a few different staffing groups. So yes, that's freely available as well.
That's great. I was just wondering how, as a professional, if we identify that, how would we get someone onto a training and education kind of program around financial well-being? How do we connect people with that service?
Do you want to go first, Helen, or do you want me to?
I thought you maybe want to talk about.
Yeah. So if people would like to access that fuller training or training that's tailored to the needs of their staffing group, if they contact me, my contact details will be at the end, and then I can discuss with them what their training needs are.
Yes, thank you. And I'm thinking also about, say, if we have a member of the public who we think might benefit from that sort of training, and how would we connect someone with training in those circumstances?
Sure. So for members of the public, with regards to what we call financial capability training for adults, the main offer at the moment is through a program called Multiply, which is sourced from a pot of government funding that the council holds. And within that, there are a number of different providers who are providing short, generally one-off sessions around that weaves in learning about numbers with learning about money, and they do it in lots of fun ways, from anything from cooking to watching the horse racing to bingo. So basically people aren't really thinking about learning about numbers, but in actual fact, they are at the time they're doing it. So that's a great opportunity for people, and that's very locally based in and around different neighbourhoods in the city.
Great. And Helen, are there any other examples that you'd like to highlight of work that's happening in Nottingham City?
So yeah, so I think I mentioned some of the work that is happening across in Nottingham, but also linked to our wider integrated care system and kind of partners across health and care. And there's a lot of emphasis around social value. So in every decision an organisation is making, thinking about the impacts of that for their staff and for the local population. And I think being really good employers is part of that, paying the real living wage and having really good policies. But we'd really like to extend some of that thinking in and around our work on health inequalities to consider maybe some of the cost barriers in and around appointments and the ways we maybe structure our health and care services. So an example I often use is talking about if we're, inviting people to appointments who use a free bus pass, is the appointment at a time when the free bus pass is eligible, that they can use that to reach the appointment. So it's thinking about some of those more structural aspects about how we organise our health and care services so that we're really promoting access. And back to your point, your example of the patient with diabetes and maybe an insecure work pattern, how do we enable both the access to health and the healthcare services and the ability for people to earn and steward the resources that they do have?
Yeah, that's a really interesting point, Helen, because that takes me back to when we were planning the COVID response. And I was thinking about where we were thinking about citing respiratory assessment centres, for example. And there was a lot of conversations about, are these on bus routes? How will people get there? And I think it felt like we were maybe better at having those conversations during that crisis time than we necessarily are now. So that's just sort of brought back those memories, Helen, and just thinking maybe we need to think more about that going forwards.
One of the things about COVID is we were so focused on reducing inequalities and working in part. And I think the other thing about both COVID and some of the work I've seen around cost of living response is that real partnership approach to how can we do things differently and get the best possible outcomes.
Yeah, so maybe we need to learn some of those lessons again. So just thinking, kind of looking forwards, what can people, so there might be patients watching this or citizens or whatever we choose to call normal people out there, non-professionals, and we'll have a lot of professionals watching as well, both working in social care and healthcare. What can people do to get involved and support people? What would you like people to think about doing?
I mean, I'm always going to jump in on have a conversation about money. We know it's one of those slightly awkward, particularly British kind of psyche is it's not always easy to talk about money. It's not easy to talk about money difficulties. I was reflecting previously with Andy that a lot of healthcare professionals are very skilled in having what can sometimes feel like difficult conversations, and healthcare professionals are well placed to ask, and there's no perfect question to ask, but just, to ask if there are some, if they're having money worries, is money affecting their health, are they having difficulties, exploring some of that, and then knowing how and where to signpost. So we can, tell you about some of the training that helps people feel more able to do some of that.
I've just had a thought in response to that suggestion, actually. I'm just thinking about when I'm more likely to ask about money, and it's probably more in those mental health conversations. I think we're probably good at asking about financial stress and pressure then, but there are other times where I will often ask. I'm thinking about, if you're doing a medication review and you're talking about medication compliance, often actually paying for prescriptions. Often if people have multiple prescriptions, that can be a useful time to have that conversation. And also if people are struggling to sort of get to appointments, you notice a pattern of not attending that doesn't quite fit with someone being completely disengaged with their health conditions in other ways, that's a good opportunity to ask as well. And the final thing is, I think sometimes where health professionals might not ask about certain things, it's because they're not clear how they can help, because it's quite difficult to kind of uncover a need and bring that into the consultation and then not have anything that you can do effectively about it. So I think towards the end we'll be talking about some resources that people can be signposted to, but those were just my my thoughts about how money comes up in consultations. Yeah, what else might people do out there around this issue?
I would just ask in terms of bringing up the conversation that I think in terms of my years in this field, now is possibly in some ways the easiest time to start talking about money because of the cost of living crisis. Because it used to be more uncomfortable to talk about money than it is even now, but because of the cost of living crisis, which everybody is aware of, that perhaps I think makes it a little bit easier to kind of talk about how people are finding the cost of living crisis. So that would just be something to bear in mind, that it is perhaps a little bit, it's part of everybody's everyday conversation.
Yeah, you're absolutely right, actually. And actually, I'm sometimes surprised by the sorts of people that, I wouldn't necessarily think are experiencing financial difficulties, but are. A lot of those conversations for me seem to be around housing, actually. Changes in the interest rate on people's mortgages can have a really big effect on people that you wouldn't expect it to. And also, a sad thing that I often am told is that the landlord has really put up the rent, or the landlord is selling the house that I'm in, and actually now I'm entering a financial and housing crisis due to this. So actually, sometimes not your typical people that you would expect.
Yes. I think there is, just to say on the housing, Andy, which you've mentioned, if people are facing challenges around housing, there are, it'll be in the list of help at the end, but there is help, particularly through the Law Centre. Nottingham Law Centre specialises in housing debt issues and other issues around housing. So there is that help there, as well as housing solutions in the council once somebody is facing eviction issues. But there is help available. So I just would want to flag that up.
That's great, and we'll start to signpost to some of those things in a moment. But was there something around primary care networks, Emma? Some work being done in that area that we wanted to talk about?
Absolutely. There's a couple of other examples. I'll just come to, if that's okay, Andy, just flag up the in terms of primary care first of all. So the Financial Resilience Partnership started discussions on a kind of advice on prescription type model in the start of 2022, and that really, this idea is not a new idea. We're actually quite late to the table. So it's an idea that goes back to 1985 is when it's first kind of reported in the British Medical Journal, and then there have been various models up and down the country, not loads of places, but a few, where a kind of welfare advice, help with benefits and debt issues has been set up within the primary care settings. So in Nottingham, we started that. That went live from August 2022. We had three primary care networks in the city, which was Nottingham City East, and then Bulwell Top Valley, and then Bax, which I think some people on this call will know has now been split into Aspire and Raleigh. We are keen to expand that to other primary care networks. So again, if somebody is listening in from another primary care network, please do contact me, and then I can talk in more detail about how the project works and the mechanics. But essentially, we have a welfare advisor based embedded within the primary care network.
Excellent, thank you for that. And yes, that's operating in my primary care network actually, and is proving to be really, really helpful for these issues. So Helen, I guess people might identify sort of training needs, within their teams or personally. They might want to learn more about these issues, and then I guess people probably want to know some websites where they can sort of bring up information during consultations or signpost patients to. So can you help talk us through some of those?
Yeah, thanks, Andy. So Emma has mentioned a kind of bespoke training offer that we have in the system because of the, having the Financial Resilience Partnership locally. So please do contact Emma in and around that. But in terms of sort of some of the routinely available training, I'd really point colleagues towards the All Our Health e-module on financial wellbeing, jointly developed with the Money and Pension Service. And actually what's really good is it is sort of 20 minutes or so overview of some of the issues in and around financial wellbeing, and it's really relevant whether you're a frontline worker or whether you're a senior strategic leader in health and care services. And so that's my kind of first port of call. I think in terms of resources and knowing what's available locally, we've got our Ask Lion website in Nottingham. Most people will be aware of it. It has really well developed money pages. So if you go onto that web page and go look for or search for money, and a whole range of resources really accessible right across the public, and so that's worth looking at. And for professionals, actually the Financial Resilience Partnership have a really good resource on their website, which is about the kind of the different services that are available locally in Nottingham, so kind of point you to that. So there are a whole range of resources. I think as well, it's interesting you're just the reflection about how the social prescribing advice link workers working locally. So much of this is about relationships and trust and the ability to signpost and support. And Emma was involved in some really excellent work to bring together frontline money help services alongside mental health services the end of last year, and kind of need to take that work forward. But actually it's part of building that awareness that there is money help available in the city and linking people across.
That's great. And I was able to find a lot of those resources by just putting those keywords in, Ask Lion, Nottingham, money, that gets you there. Nottingham Financial Resilience will get you to those websites. So they're very easy and accessible to find. And hopefully Tim, our editor, can pop some of those things on screen at the moment. Emma, did you want to just come in there?
Yeah, just on accessing services. So Jeff, that's great. Thanks for sharing those details. I would just want to flag up something about food, because there's quite often a bit of confusion about food banks. So it's perhaps helpful for people on listening to this to be aware, because we do get asked quite a lot, and there's quite often, like I say, a misconception. So food banks, I think, as I mentioned earlier, are there for people in food emergency. To access a food bank, you really do need a referral or a voucher from a key worker. So lots of key workers, including key health workers, will be set up as referrers. But that's where the access to a food bank comes from. There are other things on our list of services and also on the Ask Lion money pages around cheap food, more affordable food options, like community supermarkets, also some of the social eating places. And then obviously there's all the other help around accessing money, which hopefully will maximise people's income so that they'll be able to afford more. But I just thought it was useful for people to understand more about accessing food banks, because I even yesterday from a health professional, I had a kind of similar conversation.
Yeah, and you're making me think actually maybe that's a future podcast, talking about the food issue in particular.
Yeah.
So we'd probably like to have either or both of you back in the future. It's just struck me actually, having just kind of had this conversation, that there might be sort of managers or service leaders or leaders within the system who've got this far and listened to the podcast. Actually some of the content here would make a really good sort of training discussion within a practice, perhaps during an internal protected learning time, and just highlighting where those resources are and perhaps making those more easily accessible within a practice or service environment would probably go a good way to helping those professionals help people better with financial welfare. I think I'll take this opportunity now just to thank you both. Thank you, Helen. Thank you, Emma, for joining us. And thank you, everybody, for listening. Hopefully that's been helpful, and might be great to have further conversations in the future. Thank you.